Ricardo Cobos. I'm a physician. I'm a chair of internal medicine at Kern Medical. And we're proud to be here with you today to talk about valley fever. I would like to introduce the distinguished panel that we have today. First of all, we're honored to have Congressman T.J. Cox with us today. And I would like to introduce the members of the Valley Fever Institute team. First is Dr. Royce Johnson, who is one of the pioneers in valley fever in the nation and throughout the world. Along with him is his two colleagues who are also outstanding physicians recognized throughout the country, Dr. Arash Haidari, who's an infectious disease specialist, and Dr. Rasha Quran, who's also an infectious disease specialist. They are the key physicians in the Valley Fever team. And then also is Rob Purdy, who is a patient advocate, and also Dr. Augie Munoz, who is a pulmonary specialist and has for decades been involved with Valley Fever. So before I just turn it over to Congressman Cox, I just wanted to say what I guess the people in this audience probably know is how valley fever is endemic throughout this community. I came from Texas and relocated to Bakersfield 3 years ago. And I can tell you probably in the 25, 30 years that I was in Texas, I may have encountered maybe half a dozen to a dozen cases of valley fever throughout those decades. And I knew when I was coming to the Valley, here the Central Valley in California, the valley fever was a big problem. But I was totally shocked with what I saw. And what I saw was that every single day we were admitting patients with symptoms and disseminated valley fever to the hospital. And even on my patients, and I'm not an infectious disease, I'm an oncologist, but in about half of the patients or a third of the patients, valley fever was somehow in the history. Either they had it or it was reactivated or they caught it. And I was just totally in awe and shock of how endemic and how much of the problem valley fever was in this community. And that something needed to be done. And we've all have recently heard all of the attention that is going on with vaping, which is definitely a big problem. But just kind of put it in perspective, I don't know how many people have died recently, probably just a few dozen. But just in this community, within a year, there were hundreds and hundreds of patients that were affected with valley fever. And so it needed to get some national attention. And luckily, we're so fortunate in this community to have representatives such as Congressman T.J. Cox, who have taken the lead and said, this is something that our community needs to work on, and from a political and from a legislative standpoint. And they've been the leaders in developing the Valley Fever Institute here in Bakersfield. And the information that we're learning is going to be applicable to all across the country and all across the world. So Congressman Cox, let me turn it over to you so you can brief us on what is happening here. Okay. Thank you.
Well, thank you so much, Doc, and good morning, and thank you everyone for being here today. I'm proud we've gotten together the best clinicians, researchers, the advocates, Rob, on this issue in this one room to help us chart the way forward on fighting valley fever. This isn't news to anyone here, but despite nearly 3,000 cases, 2,937 cases in Kern County alone last year, valley fever research and education has lacked the support that we need to prevent the spread of this disease. And while valley fever is a growing issue throughout California and the Southwest, it's especially dire right here in the Central Valley, where nearly 30% of all cases in the country are reported. 30% right here in the Central Valley. And the cases of valley fever, as we all know, are increasing. In fact, they're increasing by a factor of 3 since 2014. And so there's no signs of it stopping. So we know that we can and we must do more. And according to a recent study that was just out, I think just a couple weeks ago or so, we happened to be looking, that scientists at UC Irvine have reported that valley fever is projected to expand northward by the end of the 21st century because of climate change. And they predict that valley fevers will actually grow by at least 50% more. And so I went to Washington with a promise to our community, and that I would do all I could to bring back the support we need to stem the tide of this disease, and also to protect and expand healthcare access in the Central Valley. And right now, we are working on very important legislation, and we're going to use today to inform that legislation to do a couple things. One, to ensure cases of valley fever are diagnosed correctly. Two, to educate more people and healthcare providers on valley fever. And three, to expedite enrollment for valley fever patients into clinical trials. But I need your help, and that's why we're here today. Now, the voice of the Valley must be front and center in this discussion. I'm going to assume that everyone here, certainly that's here today, has been impacted by valley fever in one way or another. Either a family member, a friend, a coworker, or a neighbor has had valley fever. In fact, I spoke on the House floor about my constituent, Paula Massey, who lost her son to valley fever. And I'm sure many of us here know somebody that has experienced that same tragedy. Rob Purdy, patient advocate with Kern Medical, is here today. I want to thank Rob so much for sharing your story and experiences with valley fever. And there's tireless advocates like Rob and Paula and so many more who are helping move the needle on this issue. We're very thankful that Governor Brown signed a bill requiring the State Department of Public Health to conduct an outreach and awareness campaign to educate healthcare providers, physicians, and the general public about the symptoms and treatment of valley fever. But we must do more, and once again, I work for you, and so I'm going to be relying on you to help me guide this process as we craft and introduce legislation going forward. Thank you so much to the Valley Fever Institute, to Kern Medical Center, and special thanks to Bakersfield College for hosting us today. Very special thanks to Erica for all you did in putting together this event, and of course to all of our expert panelists. Thank you so much for all your hard work and your leadership on this disease, and very much look forward to our conversation today.
So, Dr. Johnson, so can you just review for us just briefly, what is valley fever? I know it's a fungus, it's in our yard. Just maybe to introduce the topic. Most of the audience is aware, they've heard it, but maybe, what can you teach us about that?
Well, as you said, it is a fungal infection. It grows in dirt. It actually doesn't grow in your yard to any extent. So any place that's watered and fertilized really doesn't support the growth of the fungus. So it's mostly natural or relatively undisturbed soils. That may not be entirely true. The wind blows, the fungus spores snap off. They travel through the air. They can go 75 miles. So we definitely have cocci on the Central Coast, and even sea otters have cocci, and we know they didn't drive through Bakersfield. So it can travel quite a good ways, and you inhale the spore. It sets up housekeeping in the bottom of your lung usually and causes a pneumonia. People often say, I had pneumonia and valley fever. Actually, valley fever is a pneumonia. There's at least 100 kinds of pneumonia. And from there, it can spread anywhere it wants in your body. And, in a small percentage of patients, most people actually don't get sick. And the ones that get sick have a relatively modest illness. It's about the worst 10% that most of this effort is aimed at. And the 1% who get meningitis, as Mr. Purdy, and other disseminated disease are the main focus of our care at the Valley Fever Institute, although we take care of all stages of the disease.
Okay. Thank you, Dr. Johnson. So, Dr. Hyder, is there anything that we can do to protect ourselves against that?
Definitely exposure to the dust is absolutely a risk factor. So if you do see a physical dust coming to your face, that's the day to avoid it. There are some studies that shows some type of special masks, we call them N95 masks, might protect the spores for you to get in. unfortunately, in any day you can get the spore into some degree, but if you can avoid at least getting the high inoculum or high number of spores into your body with having masks or avoid that dust situation, that would be something preventive. Of course, if you have a good immune system and you can avoid situations that brings your immune system down, like being on immunocompromising medications like steroids or some tough medications that will bring your immune system intentionally, will make you less prone to get this disease.
So there's no vaccine or, preventive medicine or anything that we can do, at this point.
We are hoping, and there's studies going on with our colleagues with the Arizona and us. We're working on that. Dr. Johnson probably knows the story more, but at this time we don't.
And Dr. Goring, what would be some of the symptoms that people can have? I was surprised that at least when I've encountered some patients just had what appeared to be a bad flu. Is that the way that it presents? Or?
Yes, like Dr. Johnson mentioned, the majority of people will have no symptoms and they will recover without knowing that they had valley fever. About 60% of people who get infected. Those who do get sick, the usual symptoms start with pneumonia or flu-like symptoms, depending on the severity. So the main one is fever, obviously valley, that's therefore the name valley fever. Fever, cough, that's usually dry cough. Headache tends to be more prominent symptom initially also. So fever, cough, chest pain, it hurts when you breathe or when you cough. And then this is the initial presentation. Later on, if it does disseminate, then it can appear in any part of the body and the symptoms will be different. So meningitis patients are not going to show up like the typical meningitis we know, with neck stiffness and high fever. It's a more indolent presentation. They come in with just headaches that are not going away. That's really the main one that would be a good clue. Have a headache that's not going away and I'm not used to this headache. So that's a big one. And then obviously any other part of the body can be involved. So really if you have something going on that you're not sure why it's happening, it's a good idea to get checked out.
So it can start as a respiratory illness, but it can affect any part of our body. Is that correct?
It can spread,
yes.
Yeah. And it doesn't have, so the severity of the initial respiratory illness does not necessarily correlate with who's going to have a spread of the infection. So it's not like people who get more severe disease disseminate more initially. So it could be a very mild respiratory illness at the beginning, and then later on they just present for the first time with the meningitis or with dissemination. So it's a really tricky disease to deal with.
So Dr. Munoz, so would it be appropriate if I had a respiratory illness and was not going away and I went to see my primary care physician, do primary care physicians know about valley fever, or would it be okay for me to say, could this be valley fever? In other words, can I be proactive and ask my primary care physician about that? And is there a test that could be done to determine right then and there whether I have it or not?
The answer is yes. These days, everyone's empowered, and you're empowered. I would expect that most of the physicians that are coming to work here are familiar with valley fever, but we have new people coming all the time. And some of those new people are only reading about valley fever. They don't know all the little nuances. And there's a lot of different ways that valley fever can present. So yes, you can ask for a test, and we do have a blood test that can at least start the questioning and to find out whether or not you've had valley fever. That test itself has you have to have some experience dealing with it because there's different people that do the test, and there's different portions of it that are reported. But at least it gets you started as far as thinking about valley fever. And it's something you have to think about. I mean, I was born and raised here. I had valley fever. I didn't know until I got to medical school. So most people are going to get it and get over it. Other people may not. And so you have to be suspicious if you have what sounds like a flu and it's taking longer to get better, especially if you're working hard or you have some other medical problem, you're not getting enough rest, you're not taking care of yourself. You can be partying hard too and just be as run down. It makes it easier for that valley fever to affect you. And I would make one more comment. Take advantage of your experience at this institution. I went to this school. It's a good school. Use it to your advantage and go for the gold.
Good. Thank you. And Mr. Purdy, can you just share a little bit maybe of how it affected you, how it affected your family, and just some of the issues that you've had to deal with?
Yeah, absolutely. As Dr. Johnson mentioned, I was diagnosed with the meningitis form of the disease, which is one of the most severe forms of valley fever. It's still about 30% fatal today with current medication, and even with these great doctors up here on this panel. So my first symptom was January 1st, 2012, and my symptom was simply a headache. So I woke up New Year's Day with a severe headache. It just did not go away. My wife, who is amazing and attentive, would stuff Advil and Tylenol down my throat every 4 hours like clockwork to try to help control my headache. To give you an idea of the severity of the headache that I was experiencing, if you have TV and a cable box in your room, you know there's that little light on your cable box. I had to cover mine because that light was too much for me. That's how sensitive my headache was. This persisted. I went to an urgent care as we normally do, and they prescribed antibiotics for a sinus headache. I did a complete course of antibiotics, and I got no relief. I did what everybody else normally does. I went to that urgent care, and they didn't take care of me. I'm going to go to a different urgent care because obviously that guy didn't know what he was talking about. So I did. Same diagnosis, new antibiotic. I start that process of that antibiotic with still no relief. So I went and saw an ENT specialist, and I said, they tell me I have this sinus headache and it's just not going away, or this sinus infection. And I've taken antibiotics, and he says, well, he happened to be on Truxton right next door to one of the x-ray places. And he said, well, go next door and have him take an x-ray of your head. I'm like, okay. So I went and had the x-ray done. I came back. He looked at it and said, there's nothing there. And I said, well, yes, doctor, but what about the headache? And so there was no evidence of a sinus infection. So that was the extent of his ability. So I ended up at an ER. Again, only symptom is a headache. I'm taking Advil and Tylenol every 4 hours religiously. So they say, okay, it's cluster headaches. They gave me headache medication. And I went on my merry way. So 24 hours later, and during this time, now remember, January 1 was the first symptom. We're now getting close to Valentine's Day. We're in February of 2012. I'm at work trying to do a presentation. I'm doing it from PowerPoint, and I look at the PowerPoint, and now I see 2 PowerPoints. So I completed it, amazingly, and we call and go into the ER. So now I have 2 symptoms. Now I have a headache and vision issues. I ended up at the emergency room at Kern Medical. They got me in actually really quickly. They were very good about that. And then I saw a resident in the ER. He took my temperature. According to hospital standards, I didn't have a temperature. My temperature wasn't above 100. It was like a low 99-degree fever. They said, okay, we think we know what you have. They did a lumbar puncture on me in the ER and admitted me, and I had valley fever. So now the next memory I have of an actual date is I'm out of the ER, I'm admitted to Kern Medical, it's Valentine's Day, and my wife is bringing me dinner and flowers in the room at Kern Medical. So that's kind of where it went. From there, I was released and tried to go and have a normal life. Still in a lot of pain, still in a lot of discomfort. October, I was readmitted to Kern Medical. The drug that they had me on didn't work, so they started me on another drug. I was released. About 6 months later, that drug doesn't work, so they put me on my 3rd drug. The 3rd drug is a pill. In addition to that, they scheduled me for a procedure called an Ommaya reservoir. So if you see this little horseshoe thing on my head, that's actually a port. So it's connected directly to my brain, and they inject medicine into that port. So I started out getting 2 treatments a week, and now I get 1 every 7 weeks. And if you think that sounds really horrible and scary, and it is, I need to tell you that there are people at this hospital that have been treated longer than I have and are still doing it 3 days a week. And you lose that day. So that gives you an idea of how difficult this can be from a patient standpoint. I consider myself extremely lucky. So I had when I was admitted to Kern Medical, I was diagnosed by a resident. I was lucky to end up at Kern Medical because as soon as I was there, they knew what I had. So 2 of the doctors on this panel were my doctors. Dr. Johnson was my primary care doctor, and Dr. Haidari was my infectious disease doctor. So imagine the luck I had that I got those 2 doctors. I also was very lucky that I had some support structure from my family. But you would think that with a diagnosis and knowing a plan of action that it gets easier, but it actually gets harder. So things that happen. So this was before cell phones were allowed in schools. My daughter was in high school. My son was in junior high. We lived on the west side of town. I was in the hospital for about 6 weeks. So as difficult as it was for me to be in a hospital bed, my wife was driving across town every day with trying to be a parent to our kids while dealing with the husband that she did not think was coming home from the hospital. And it was very hard on her. Like I said, my daughter, when she was in high school, they weren't allowed to have cell phones in class. She was allowed to have a cell phone. That's how sick I was. That's how devastating this disease can be. So it's very hard to, it's very easy to classify the 3,000 cases. It's very hard to talk about the personal toll. So you have to remember with these 3,000 cases, this isn't like 3,000 flu cases where these 3,000 cases are once and done. Of that 3,000 cases, let's just say 100 for easy math. 100 of those patients are going to be patients for valley fever every year for the rest of their lives. So this is it's a snowballing program, and it just takes more and more resources every year. And as cases are more and more diagnosed, we're going to see that even more. There's no way to measure the impact of this disease on this community.
So what do you think, maybe that someone from the panel, and then we'll let the audience, what are some of the resources that we need in this community to improve the situation? Dr. Johnson, you want to comment on that? And it's 3,000, it's 3,000 cases here in Kern County, but in California, I'm assuming
it's roughly 7,000, I think, in the state. Well, we do have resources clearly to care for people that have valley fever in this community. But the persons have to recognize that they have an illness that requires evaluation. Second of all, they have to go to a physician or other provider that recognizes that valley fever is at least a potential possibility for the cause of their illness. And you can see how in Rob's situation that didn't happen very quickly. And then you have to have the financial resources to care for that person, and that is still a bit of a problem. Kern Medical's made a substantial effort to see to it that everyone gets care. As we move forward with the Valley Fever Institute, we hope to address some of the issues that Rob brought up about his family in the sense of making it a whole person care facility, in the sense that we will try and take care of people's psychosocial needs and help them with their financial issues, as well as providing expertise in the medical care. And so that's the short-term goal for people that are afflicted. Long-term goal is better drugs. You can see that Rob went through several of our anointed treatments, and they weren't as effective as we would have hoped. Unfortunately, that's not a rare circumstance. And so we hope for new drugs. And then as I think Dr. Haidari already mentioned, ultimately a vaccine would seem to be the best answer. And sometimes vaccines are easy to make. This isn't one of those times.
Are there any questions from the audience? Yes, sir.
We spend each year on valley fever in California or Bakersfield?
I don't know the answer to that question. One of my research partners in years gone by, I think in 92, which was a very big year, we had an epidemic that doesn't get reported on much in Kern County in the early 90s. The state didn't really start counting until 95, and they did that because of all the cases we had in 92, 93, 94. So if you see that this was the biggest year, actually the biggest year I think was 93. But it went down a bit, and now it's been steadily up in recent times. And I believe we said in 92, obviously dollars weren't the same then, that we spent over 50 million in Kern County in 92 on care of people with valley fever. I'd guess, but it's a guess, not a anointed figure, that it could be as high as 200 million or something of that sort.
And how much do we get for funding as far as to do what you were saying to
Well,
medication?
Well, so that's sort of a two-part question from the way I'd view it. One, the Valley Fever Institute has been very fortunate because of our state representatives, bipartisan, that we have $5 million in funding that's allowed us to really try and carry this effort forward. But of course, there's a fair amount of money in Medi-Cal and Medicare and private insurance and personal funds of individuals that go into the support of the health care.
It just seems like a little bit of preventative maintenance would go a long way in this case.
Yeah, I was gonna, if you put it in perspective, you know, I'm an oncologist, and for example, there's certain types of lymphomas, which, you know, there's an incidence maybe about 20 to 30,000 cases per year. But when you look at the funding that is given to study, you know, those type of lymphomas in terms of basic science research, clinical trials, education of physicians, and other resources, it's several $1 million. And I think the point that you're trying to make is that it seems like valley fever is kind of an orphan type of you know, infectious disease. And Congressman, can you talk about it? Because it's only been in the relatively few years that I think we started to get help, and hopefully, you know, there'll be some more initiatives that will move this further along.
No, your point is right on the mark. Is that look how much we spend just here, 200 million, 150, you know, compared to how much we actually put into it, and that's one thing that our legislation is going to be looking at. Really, what the return, just strictly on the, not strictly on it, but certainly on the economic returns. I could tell you one thing is that I think we'd be in a different situation if this was called Silicon Valley fever. All right? Look at the resources that would be, you know, marshaled towards this disease if 3,000 people in Santa Clara County. No disrespect to them,
right.
but it is a bit of an orphan disease. But that's why we're bringing light, you know, to how this affects so many people and so many communities. And certainly, as we were saying before, not only here in the Central Valley and the Southwest, but it's going to continue to grow.
Yes, ma'am. There's two questions over here. Go ahead. Yeah.
Is there something that we can do as patients if we go in our doctor room? You know, we have these continual illnesses like he did. Is there something that we can say more forcefully to our doctors to get them to listen to our symptoms?
Dr. Haidari, can you answer that?
Sure.
Yeah, okay.
Let me give you a perfect scenario. A patient is knowledgeable because the Valley Fever Institute did this job. They know about the disease. Happens to be a farmer, goes to see a doctor. I'm coughing for 2 weeks. I have some fever. I'm having some night sweats. I sweat all the time. I lost weight. The doctor is also educated because we did a good job in educating the doctors. The doctors does the exam and they found that the patient probably has a pneumonia by listening to their lung. And both these things you have probably have a valley fever because you've been exposed. It's because your job tells me that. You live here. So we start treating you as both as walking pneumonia and also valley fever at the same time. I'll do some blood tests today, shoot an x-ray, you come back next week. Next week you come back, x-ray is positive, blood test is positive, and you're on treatment. That's perfect scenario. Unfortunately, 95% of the time, this never happens. In some exceptions, there are some emergency room doctors that they do very well in that in our own community. I think to answer your question, the public awareness. You live here, you have valley fever, you have to ask for those symptoms. It maybe fits to me because I think I have been exposed to that. This is my job, to force the physicians to do get the testing, do the right thing, at least remember what the right thing is, and go from there.
I think that's a great point. Not all the physicians were born and raised and educated here. I can tell you that when I came from it, I had many times where the patients would tell me, hey, Dr. Cobos, I have the flu, and you're saying it's just a flu, could this be valley fever? And then I would have to say, you're right, until I got educated. And a lot of that education actually came from the patients that were reminding me, hey, this, could this be valley fever? So that's a great point. Yes, ma'am. Yeah.
My question was, what is the plan for the subgroups in our community who don't have specific access to medical treatment? I mean, we have a huge homeless population, we have a huge farming population that don't have insurance. So what is the plan for them? Because they're not going to go 3 or 4 different times to a doctor.
That's a great question. Yeah.
Well, I think part of it is that what we're doing now, the fact that we're getting the education out, that we're trying to get funding out to establish a means to take care of it. Over the years, and I grew up here, over the years, nobody talked about valley fever except amongst you and your family. And we never had anyone that was interested, because it costs a lot of money to develop a vaccine, to develop the medications. And it was your little problem. We all have our own little problems. And it was a group of nurses that got together and said, we'd like to do something about this, because they had a very close friend that got sick. And it was a local community organization, the Shriners, which group? The Rotary Club. They backed them, and then they got the state to back them, and that started the whole thing. After that, we've been able to launch from there. But for the people that have no resources, we still have places like Kern Medical where we can see them. And the homeless people, again, they have a lot of other problems besides valley fever. They're not likely to get valley fever on the street unless they're in a dust storm. But they need to be seen and be evaluated, as anyone else who's down and out needs to be seen and evaluated, and the problems they have looked at. And if valley fever is one of them, yes, we can start treatment. We can find resources to treat them. We are able to marshal resources to treat the people once we've diagnosed them. It's a whole matter of diagnosing them, and it's a matter of doing something yourself. So if you know there's dust, stay inside. If you're driving through the dust, use the recycling in your car. If you have the recycling in your home, use the recycling in your air conditioning. If you're going to do something outside, like play soccer or something, wet the ground down. Don't make it muddy. You don't want to play mud, but do something along those lines. If someone's going to do some work around your yard, around the house, again, if it's going to be soil, and the soil that this organism likes is a combination of loam and sand and loam. That's the kind of soil that it likes. And it likes kind of hot weather, not that much water. So our place is perfect. 3 months of the year we get water, the rest of the time it's hot. It's not that cold in the winter. So people have to kind of do some proactive things themselves, and I think that'll help. And we are always reaching out for those folks. And a lot of the institutions or the other hospitals will also reach out, but part of it's going to come from public pressure, from our senators, from our other elected officials saying, let's do something about it. And I think that there are folks that are at risk, and so we have to be aware of the things. And I think this is a good example. I never had this when I went to school. You're seeing it. Other people have seen it. I've given 3 or 4 talks through the community about this, and there's a lot of awareness, and people are asking their doctors. And these days, you are empowered. You can ask your doctor. And if not, you can come to the Valley Fever Institute. We can arrange something. So if you're stuck, you think no one's paying attention, there's a way to get some help. And I think this is what we're trying to do. Yeah. We're trying to establish that link, trying to open it up for you and for anyone else who's concerned. At the same time, you don't want to be paranoid about it. You just want to use some common sense.
So he brings a good point in terms of one of the things that the Valley Fever Institute is trying to do is to get out from just into the hospital, into the community. So it could be groups such as yours it could be farm workers, it could be the homeless shelters, just educating everyone, and then channeling them and providing the resources for it. But that's a great point. Yes, sir.
Dr. Joe Hayes, I'm the Chief Medical Officer for Optum Family Health, and I just wanted to mention in response to that community health centers are a safety net in the community that also sees a lot of the homeless population, the farm workers. We serve as a safety net, and so I recognize the importance of educating health centers, especially when they come in from other parts of the country. I came from New York, but I went to Phoenix area first, so I got used to valley fever before I came here. But I think also just making sure that, however we can, that our payment models give us the time to give attention to our patients. So it's not, we've got a sinus headache, gives antibiotics, go home. If we can take the time to listen and understand what's going on.
Yes, thank you. Yes, ma'am.
Dr. Johnson, you mentioned something that hopefully we would have better medication for valley fever, et cetera. But the only thing I could think of, affordable medication, because there's many families who are well-off families, and once they have to go to the medication, of course, they have to declare bankruptcy, right? They can't work anymore, someone has to take care of them. So bankruptcy is happening with valley fever all over the place. So now they're broke. Now they can qualify for Medi-Cal. Can you believe that? You have to declare bankruptcy, everything, because the pharmaceuticals, money. And so now they can take medication because they don't have any money, no access, no anything. Medi-Cal, thank God for Medi-Cal.
Yeah, so
Well,
there's a financial burden
I would,
to the disease as
Your
well.
last sentence, I like, thank God for Medi-Cal. We'd have serious trouble in this county if we didn't have Medi-Cal, because I believe 50% of the population is on Medi-Cal, and a very large proportion of our patients. Well, you're telling a sad story that unfortunately isn't even limited to valley fever. The number one cause of bankruptcy in America is healthcare cost, and a lot of that has to do with pharmaceuticals, but has to do with other aspects of the healthcare industry as well. So I strongly feel your pain, not personally, but professionally, and I totally agree with you. Even the least expensive medications for valley fever are relatively expensive, and the intravenous drug we use costs $6,000 a month. And the most expensive pill we use is around $4,000 a month. So this is an expensive disease. In my own defense as a disease person, I would point out that Dr. Kobos's illnesses cost even more and probably cause more bankruptcies than valley fever. And I'm sure he feels that pain as well. So this is a problem that I think very fortunately we have Representative Cox here today, and I'm sure he's heard this story before, but he can add this to the list of stories that he's heard, and hopefully we will at some point or another have legislative relief so that we don't hear stories like you just told.
Yes, ma'am.
Good morning. My name is Julie Solis, and I'm with Valley Fever Awareness and Resources. Our community group is a catalyst to this Valley Fever movement that's been going on. I'd like to start by thanking you all, the Valley Fever Institute, for holding this town hall. Valley Fever has been plaguing our community for over 100 years, so it's great that we're finally getting a little bit of support in the community. To the lady's question up front, we have to advocate for ourselves. Don't wait, don't depend on the doctor. My husband was misdiagnosed for over 6 months. On his deathbed, they found valley fever in his brain. He's been living with it now for 11 years. About 3 months after he was diagnosed, my daughter began to get sick. She was in second grade. The only thing that I noticed was her lack of energy. She was exhausted. So on about the second day I noticed it, I asked her, I said, Marisol, why aren't you playing? And Marisol told me, Mommy, I feel tired. When I wake up in the morning, it feels like I need to go back to sleep. So because I was educated on valley fever, I called her pediatrician and requested a test. I brought her in to Dr. Roldan, who was the only pediatrician my children had, and she told me that my daughter was probably depressed. I told her to please test my daughter. Then she told me, let's wait a while. I asked for the test. She refused 3 times. The third time, I told her if she did not test my daughter, I was going to call the insurance and get a new doctor. She went ahead and tested my daughter. As a matter of fact, she tested all 3 of my kids to put me at ease because she thought I was a hypochondriac. 3 days later, Dr. Roldan called me. The first thing she said was, I'm sorry, Julie, you were right. Your daughter has valley fever. So we cannot wait, and I cannot urge this enough, to wait for people to advocate for us. If you are sick, if you've had a constant cough, any of the symptoms, you don't have to have them all. My daughter's only symptom was exhaustion. So I just wanted to point that out. And then earlier we talked about, what can we do as a community, our community needs. The psychosocial need is huge. As a valley fever advocate, I've met thousands. One of the most disturbing was last year, a 13-year-old boy tried to commit suicide the weekend before school started because he had missed his whole 7th grade school year, and he was scared to go back 8th grade with a port in his head, not knowing what they were going to do the other children in school. So addressing those needs is huge. There's a local group, National Alliance for Mental Illness, NAMI. We've partnered with them for 3 years. We do monthly meetings to meet up just so that people know that they're not alone. Another need that we have in the community is local pediatricians. I have dozens of children locally who have to travel to Madera sick. They have to travel there. So that's another need that we need locally is pediatricians. When your child is sick, there's a 6-year-old girl who in the middle of the night, 3 a.m., they have to start their journey to Madera for testings. So that would really help our community. Something else that we really need is research to better identify this disease. As many of you guys know, this disease, when you get your blood work, about 50% of the cases are not correct. So if you're sick and you get a test and it comes back negative, you need to know to go back, maybe wait a few weeks, a couple of weeks, a month, come back and get retested. We need to really work on how we can identify this disease. And then also in Arizona, Dr. Andrew Lutz, he works at Pueblo DNA, and he's actually working with high school students, and so they're learning about cocci through a science route. And so I encourage our Congressman T.J. Cox to help to bring some education. When you teach a child, they will never forget. Bernice had spoke about that family that went bankrupt. That's me. That's us. I stand before you as a college graduate, broke, no money, no savings, no security, but a sick husband. Thank you.
Thank you. Yeah. Excellent points. Thank you for making them, Ms. Solis. She brought something that maybe you can comment on. So the test that we're talking about, is it a simple blood test? And is there some nuances of the test that we should know about, or does anyone? Yeah.
Yes, there is a blood test. There are different types of blood tests, and the problem is that. When you look at the correlation or sensitivity or specificity of results when done in commercial labs and we see results that are not reliable. And unfortunately, we only use the public health department lab for cocci testing, and I frequently see the discrepancies between results, and that's a big problem because community physicians are trying to do the best they can. They'll test the patient, they'll get a result, and then trying to act based on the result when the result itself was not accurate, and it's frustrating and confusing for everybody. So that's an issue.
So she's bringing up a great point. That something as simple as a blood test. The blood test
Yes.
needs more research to standardize it across, or to educate even the people in our community about that. Okay. Yes, sir.
My son was diagnosed and misdiagnosed due to the blood test. I believe it was the county they told us.
Yeah.
It was to a Maddie Center. And a pump full of steroids, I think it's probably the worst thing. They gave him with an inhaler to breathe steroid in his lungs.
Yeah, and if you can just contrast it, let's say with HIV, HIV that has been around now more than 30 years. It didn't take us but just a couple of years to standardize and learn about the false positive and false negatives and nuances of the test, and come up with the accurate test. And here we are with a disease that's been around for more than a century, and we're still don't even have the a standardized test that is universally accepted across the country. So that's just where we are, I think. But one of the things I think that we can be proud in about this community is that they did exactly what you're doing. What you're saying is that rather than wait for some outside somewhere to come and tell us what to do, is that we needed to start doing it ourselves. And so I think those are great points. There was another question. Yes, ma'am. So the question is, of the diseases that are reported, how many of those are those 3,000? How many are children? And is it equal? Does it affect pregnant women, older people, immunocompromised, or healthy people?
Yeah, excellent question. I don't think we actually have accurate data on that.
Wow.
I know I don't. We might have data based on age, but we don't have the answers to all the questions that Dr. Kobos posed in terms of the demographics of the population that get it. Children seem not to suffer the disease as badly as older people, people in middle age. That does not mean there aren't children that are devastatingly ill. There are. But it's in terms of a percentage, it seems to be less incidence in children than in young adults and more senior adults. And clearly older age is a risk factor for doing worse. So there are differences.
Pregnant? I thought I heard something about
pregnant. Yes, pregnant women. Again, if you look, it depends on how you look at the elephant, as it were. So most pregnant women that get cocci do fine, actually, but there is a subset that do worse than you would have anticipated had they not been pregnant. And we do see those people with some regularity and care for them. And it's complicated because most of the drugs that we use to treat cocci are in fact teratogenic, meaning they're bad for the unborn baby, especially in the early phases of pregnancy. So most of those ladies have to be treated with IV medication, and that costs $6,000 a month, and it's 3 days a week, 4 hours at our infusion center. So it's a difficult problem.
I think there was another question.
Less of a question, more of a statement now, following echoing some of the comments that have already been made here. I want to thank the Valley Fever Institute and Congressman Cox, as well as Dr. Murphy, for being an advocate for Valley Fever awareness in DC. It's important when you do that, though, when that you communicate to them that this disproportionately affects rural communities. I am Mayor Garcia, by the way, and I represent over 25,000 residents right here over in Wasco, California, just north of here. I see I'm no doctor, but and I'm no researcher, but I can see how this can disproportionately affect farm workers and rural residents because there's development happening all the time in our community. And as drills go in, as shovels go down, you know, that soil is getting turned and it's going into the air. And so, as you said, it goes up to 75 miles and it's affecting everyone in our community. So before it gets worse, I'd like to make sure that we don't forget the rural communities of Kern, please.
All right. Any other a couple more questions? How are we doing with time? 5 more minutes? Okay. Yes, ma'am.
My question was there a certain period in which, because the stories that we're kind of hearing today about how bad it's getting are usually people that have been dealing with it for some months at a time and have been misdiagnosed. Is there a certain period in which, like, if you can get in at this time, it's less likely that you may have this worse outcome?
A very insightful question that's been asked for a lot of years. And my daughter one time, when I was telling her about another person that had valley fever, and she asked me how come that happened, how come that person got so sick, and my daughter that had valley fever didn't get terribly sick. She wanted to know why, and I told her that I didn't know. And she said, "You mean you've been working on this for 30 years and you don't know the answer to that question?" So the question you really ask is the one we've posed for years: is does early treatment prevent bad outcomes? Mm-hmm. That's a generic idea in medicine, that if we treat you early when you have minimal symptoms, that you'll probably have a better outcome. There isn't scientific proof of that, but we are enrolling people in our studies, along with Kaiser, SANS PCC, that's funded by the NIH, to try and answer that question in terms of whether early treatment does produce a better outcome. We did, again, in that epidemic we had in the early 90s, we developed data that early treatment did make a difference. It wasn't a rigorous study, however. So, and there's been some other studies in Arizona that were actually much smaller than ours that suggested that early treatment didn't make a lot of difference. I personally believe that early treatment does make a lot of difference and that you get a better outcome if you're treated early. But it's still an argument. We hope to settle it soon, and I apologize that I've worked on this for well more than 30 years and I don't have a good answer to your question. But hopefully the Valley Fever Institute will help answer it.
One final question.
Thank you. My name is Kathleen Burks. I am the mother of Shane Hoover, who passed away May 10th of this year, 2019. I'd like to thank the panel for giving my son back to me to live an extra 10 years. My hat is off to you, Congressman, for taking the time to show up for us. My mother in 2002 passed away from this disease, and now my son at the age of 32 had lost his 10-year battle with this disease. I'd like to thank the state and the hospital for always making a way for us that never seemed possible. I can't stress more than enough how many cheerleaders it took for my son to live this long with this fatal disease. It took a lot of cheerleaders to get him to those 10 years. It took allowing family members that you wouldn't believe to show up in that hospital room and sit with him and cheer him on and pull him on and uplift his attitude, because mentally the stresses that it does to a young man is unbelievable. You don't go home to a normal life and perform normal duties as a man or a young man. He was a 23-year-old boy trapped in a body that could not function. And the mental health of that in itself, I just thank God every day for him having the structure before him at the hospital and at home to help pull him through those tough days, and the education you've given me about this. I'm here today because I have 25 grandchildren and a great-grandbaby and one on the way. And if I've lost my mom and I've lost my son, back in the day, the old myth was if you were raised here, you won't get it. That's a myth. Mm-hmm. Back in the day, the myth was if you know one person in your family that has it, you'll probably, or your friend list, you'll probably never meet another. This isn't social media. This is Bakersfield, California, and it's real. And it's affected my family twice. And I doubt I'll get out unscathed from 1 or 2, maybe 3 more at the rate of growth that my family is growing. But long story short, recognition is everything. And I just want to share, this is my son. He's a legacy. He's a legacy. 5 years ago today, his port failed. 5 years ago today, he went in to have his port removed because it was infected. The doctors at Kern Medical Center had done enough study and were with a neurological team, and they were able to find that that was a bacterial infection in his port. And that port, to me, was the only thing that was going to save his life. The last, it was the Holy Grail. We called several medications that Shane went through on trial studies. We signed our life away for these trial studies, and Shane always said it was about the next guy. It's always about the next guy. Well, it's about our children. Now it's about my grandchildren. It's deep here. It's deep here. This was a good man. He worked up until the day he died. A full-time job. Collected disability. Was hospitalized once or twice a year, every year. The costs were astronomical. Somehow California found a way. Thank you, because I didn't have the money. Day by day we would pray. You know, and when he lost that port, I thought my son was going to die because everything was going to be the answer until it failed. And when it failed, I've seen tears in Dr. Johnson's eyes saying, Shane, I'm sorry we failed you, only to find a new solution tomorrow. Never give up. Never give up. Make the children aware. You know, I appreciate the bad air days at the elementary schools and the high schools. I appreciate that. I think we should really adhere to that over there where you're at in Wasco as well. I think that the moral support that it takes to make it through this, if you're alone, if he were alone and he didn't have the family support that he had, Shane would have died that day 10 years ago. So I'd like to thank you. Please don't forget my son.
We won't. Yeah. Thank you. Thank you for sharing that.
I'm going to make a comment.
So, finally, we wanted to thank...
May I make a comment, Dr. Kobus?
Bakersfield,
May I
yes.
make a comment?
Yes.
I'm glad you spoke up finally. I think it was the time. It was a pleasure taking care of your child. He was lucky to have you as a mom and the family who supported him from every minute. He was a fighter, and I know he always wanted to use good newses, so I'm going to turn this to a good news. Valley Fever Institute is born at Kern Medical with 150 years of experience in academia. We are in a very unique situation. We have Valley Fever Clinic. We take care of about 20 to 30 patients a week. We have been taking care of the sickest from any type of infections. So there was the idea of passing this knowledge on. If you come and get trained in Kern Medical, you become a Valley Fever doctor. If you exclude my experience from this table, you have a century of Valley Fever expertise just on this table alone. So with the vision of training more specialists, with the support of our administrative and the leadership and department, Dr. Kobus, we are going to, for the first time in the history of Bakersfield, opening up a fellowship, train our own specialists who are going to be specialized in infectious diseases focused on Valley Fever. So we're going to train our own Valley Fever doctors, and we're going to be very focused on who we're going to hire, so they're going to stay in the community. So that was my good news to you. As a legacy of Shane, I'm sure he's going to use that because he's looking at all of us as we speak. That's all. Thank you.
Thank you, Dr. Haidari. So again, we wanted to thank Bakersfield College for hosting this event. Congressman Cox, we really appreciate you taking your time. I know you're very busy, but you heard what was here, and we appreciate all the help that you've done. Dr. Johnson, Dr. Haidari, Dr. Coran, Dr. Munoz, Mr. Purdy, thank you for what you have been doing. And then to the audience, there's roughly 100 or so of us here. We all know people, so we can start to be ambassadors and educate and being proactive, just like the young woman said, in terms of educating our friends and our family so that we can continue to continue the positive work that is being done. So thank you again.
No, thank you so much, Doc. And once again, thank you everyone for coming today. It's been so enlightening. And, to Julie, Rob, certainly Shane looking down on us from above, we're working for you. I mean, your stories are moving. That's why I'm here to work for you. And some of you may know that my wife Kathleen is here, a pediatric ICU physician. And so not only do I hear it from you, I hear it from her every night that we can absolutely be doing something about this disease. And as Doc was pointing out, what was it, 30 years ago, maybe 40 years ago, HIV used to be a death sentence. Today, you're diagnosed with early, you can live a normal life. That's our goal for Valley Fever. So when I go back to DC in just a couple weeks, we are actually setting up meetings and working with the National Institutes of Health that is certainly been working on the disease. And we look forward to getting back and talking to them to see how we can move along things like the blood testing and make that much more efficient and expeditious. And so certainly if anybody here has got any issues at all, please reach out to my office. We've got an office right here, and I think Joseph with my staff is here. We work for you. So thanks again for all the panelists for showing up, Bakersfield College for providing space, and thanks to each and every one of you for coming today. We work for you, and we look to deliver. So thanks again.